Hi, I'm Dr. Becker. I am one of the doctors that are a part of the anesthesiology team here at Memorial Hospital, and I was the anesthesiologist on duty at Memorial Hospital on July 7th when Miss Romanov came in. I responded to her case around midnight. Upon my arrival to the OR, Miss Romanov was being comforted by the nurse, and Dr. Feldman and Dr. O'Leary were present at that time. Dr. O'Leary dismissed having a report from Dr. Feldman and wanted to proceed with the C-section. The only report that I received on Miss Romanov was that the fetus was experiencing late decels and bradycardia, and that she was a class 2 airway and 137 pounds. After receiving that information, I decided to proceed with a spinal tap. After performing the spinal tap, Miss Romanov still seemed to be in a lot of distress and discomfort, and I was not sure if it was successful and wanted to take a few minutes to see how it went. Dr. O'Leary stated that there wasn't time to wait and to go ahead with doing general anesthesia instead. I was comfortable with doing general anesthesia, but wanted to reassess Miss Romanov's class 2 airway, which was a cause for concern. Dr. O'Leary, however, said we didn't have minutes and to go ahead and just put her under. I performed the general anesthesia, and while doing so, Dr. O'Leary performed the first incision for the C-section. At that time, I tried to intubate Miss Romanov, which was unsuccessful, and at that time, she did start to decline respiratory-wise, and so I made the decision to call a code. While waiting for the code team to respond, it did feel like a really long time, and after their arrival to the OR, they did state that they did get lost. After that, me and the code team present performed an emergency tracheostomy on Miss Romanov. During all of this, the fetus was successfully removed from the mother. However, the fetus did have to be resuscitated. The pediatrician was present while doing that, and that was successful. The baby boy was then transferred to the NICU with the pediatrician. Miss Romanov's case, I feel, did have a poor outcome for the patient, but also for the baby and her husband. It was my knowledge that Miss Romanov did not speak any English, but her husband did, and he was not present at that time. So I feel like she didn't really have a good understanding of what was going on around her. I also think that we all, as a team, could have done a lot better job, and the patient would have had a better outcome. I think for future cases, we can all take this as a learning lesson to do better for our patients and to make sure that they're safe.